Hi everyone, my name is Daria. I am an ENT doctor, and today I'm going to talk about the anatomical structure in our skull that determines how deep we can dive. Yes, exactly, Eustachian tube. And if you really want to dive deep, you need to become friends with it. And today I will explain how it built, how it works, and what affects its healthy function. Stay here. If we look at the eustachian tube from an anatomical side, it looks like a narrow tunnel that connects your ear with the back of your nose. And when you equalize, the air from your mouth travels through this passage into the ear and equalizing the pressure. In adults, eustachian tube is around 3.5 cm long and consists of two parts, bony part and cartilaginous part. Bony part or tympanic end is fixed, it's rigid, and it always stays open. Cartilaginous part is almost opposite. It's flexible, it's soft, and it can open and close thanks to attached muscles. The important part of anatomy is the lumen of a eustachian tube, and it's really narrow. In its widest part, it's around 3 till 5 millimeters, and its narrowest part, slim waist, is just 1 millimeter. We call it isthmus, and any swelling or some mucus here can make your equalization much harder. I think it's quite familiar situation, somewhere around 5 or 6 dive. While you equalize, you hear this teeny whistling sound. That's exactly your eustachian tube signaling you about the narrowing of its lumen because of swelling or some mucus builds up. I think mucus buildup is quite common problem because exactly our nasal breathing is essential. It helps also to move mucus from our nose to our throat. When we dive, we mostly use our oral breathing through the snorkel, or even sometimes we use nasal clip, and it provoke accumulation of mucus in our nose. And also, if we look at anatomy, the cartilaginous end form a small ridge or hood called the torus tubarius at the tube's opening. And when you're diving, especially head down position, mucus can easily get trapped here and block your eustachian tube. So in that case, when you hear this teeny whistling sound, signal of your eustachian tube, what is a good idea to have a break for a while, hang on bio, and open your mask, blow your nose slowly, and breathe through your nose to activate physiological process of mucus clearance and also clean your nose and nasopharynx from this excess mucus. And I learned one trick from freediving instructor. It's really helpful. I tried by myself, okay? And I call it like snorting maneuver. So you should do something like this. The sound is really important, like so this negative pressure and vibration helps to clean your eustachian tube from this trapped mucus. So now let's look to the teeny details, and the lining of eustachian tube is almost the same as in our nasal cavity. So when you have flu or allergies, your eustachian tube swelling exactly the same way as your nose does. That's why when you have cold or some nose congestion, it will be hard for you to equalize. The lining of eustachian tube, we will see some hair-like cells, and they move and help to pushing out mucus and dust, and some mucus glands here that produce the mucus. Mucus itself is essential. It prevents the tube walls from sticking together, and it helps it open smoothly. So there is few factors that can affect this mucus. First is tobacco smoke and viruses, because they can damage these hair cells that move your mucus, and the mucus start to accumulate at your nose and your sinuses and make more complicated your equalization. And the second is dehydration and air conditioning, because these two factors, they make mucus really more thicker and viscous, and it can accordingly complicate the opening of eustachian tube. That's why it's such important to stay hydrated and avoid food and drinks that dehydrate your body. And there's one more note about anatomy, that the opening of eustachian tube is laying on the back of your throat, and that's exactly the start of your digestive tract. So if you have some stomach problem like gastritis, reflux, GERD, or you eat something spicy that triggers the acid release, this acid can travel up and irritate your eustachian tube, causing it swelling or excess mucus production. So now let's look how our eustachian tube work. And normally eustachian tubes stay closed and protect our ear from infection from the nose and from internal body noises. And it's open passively when you yawn, when you swallow, or when you open your mouth wildly to equalizing the pressure between the ear and outside environment, and to also drain fluid from your ear to your throat. The eustachian tube can also open actively when we equalize, when we do pharyngeal or Valsalva. Open eustachian tube, we use two muscles. Both of these muscles are the part of our soft palate. And the best part here, these muscles are under voluntary control. So we can learn how to control these muscles and improve our equalization dramatically, especially in some advanced techniques. So learning voluntary control of these muscles is the pathway to hands-free, pharyngeal, and other advanced techniques. But important to keep in mind that there's some people born with ability to control these muscles. They're lucky one. The other people need days, weeks, or sometimes months of training. And other people can really struggle because some anatomical limitations. There is one interesting fact: the ability to wiggle your ears is linked to better control of these muscles. Ear wiggling involves some rudimentary auricular muscles that most people can use them, but those who can usually have a stronger neuromuscular connection in this region, and the muscles that open the eustachian tube are in the same functional block as those. And also people who are professional singers and do beatboxing, they more easily learn these advanced techniques because they already have excellent soft palate control. My congratulations, you know about the eustachian tube more than a medical student. And now let's summarize what factors can affect its healthy function. And of course, first is the nasal congestion. Any cold, allergies, any problem in your nose can lead to swelling of the eustachian tube and affect your equalization. Stomach problem like reflux, like we told before, because it can provoke swelling and excess mucus production. Environment irritants like smoke, dry air, and dehydration. It also affects your mucus clearance, and it can make your eustachian tube more hard to open. And there's two more factors: anatomical variation, because some people have more stiff or more narrow eustachian tube, and on land they equalize normally, but underwater, when there is added pressure, they can have problem. And the second, improper or too forceful equalization can causing temporary dysfunction or injury of eustachian tube. So eustachian tube is essential for comfortable free diving. Keeping it healthy and trained allows you to dive more deeper, longer, and pain-free. Subscribe, like, and see you next time.